I'm Dr. Drew Orden. Nice to meet you.
Doc.
What did you want to talk about today?
I feel like I look too old. Someone guessed I was 25, but I'm 23.
I have to be honest with you, George. I mean, I think you look 23.
Really?
Yeah, I think you look your age. You don't have a wrinkle on your face. But what bothers you?
Well, I brought pictures. I want my nose to look exactly like this.
I like your nose better.
I want my left cheek to look like this.
What do you want this big line in your face for?
I think it's artistic.
So far, what I'm seeing is quite a bit older looking than the way you look now.
So then my mouth.
George, I think I know this person.
I really want my eyes to look like that.
I'm flattered that you're bringing this picture in of me, but I think you should stick with what God gave you.
That's the face that I want.
Who sent you? I've been tricked. You got me. That was a lot of fun. You know, this is the typical thing that I get. Nobody's ever brought a face into me before, but you know, I want this nose, I want these lips. And they found a pretty good actor. This guy.
So you had no idea?
I had no idea. He sold it. So you got to give it. The producers did get me.
Well, would have been even better if you're like, yeah, those are some nice lips.
Ooh, I can.
Ooh, that's a gorgeous jaw.
Guy. No, I didn't do that.
Well, we certainly have a lot more ways to trick and treat your body healthy today. And to get us started, we have this question that came to us via email from Charlotte in Pittsfield, Massachusetts. She writes, "Hi, doctors. I suffer from acid reflux. It is especially bad when I go to bed at night. Do you have any tricks for the best way to treat it?" We've talked about acid reflux many times before on the show. A number of things you can do. Avoid caffeine, alcohol, fatty meals, and don't eat right before you go to bed because the esophagus and stomach connect at an angle. So if you sleep on your right, the stomach is actually higher than the esophagus, allowing stomach acid to slide up to your throat. Right after you eat a meal or you suffer from reflux when you're asleep, I'm going to use the couch as an example.
There you go.
So pretend, if you will, that this is your esophagus and this is your stomach. There's something that you can do when you lay down. If you lay on your left side, your stomach stays below your esophagus. You see that? So it doesn't flow back up into your esophagus. However, if you lay on your right side, watch what happens. All that acid,
Ooh, heartburn.
Right up there in the esophagus. And these cells that line your esophagus, they literally are getting singed and burned by acid from your stomach. So one little trick is lay on your left side, do some of the other things I mentioned, and then the other big takeaway for anyone who is a chronic sufferer of acid reflux, you need to make sure you're getting evaluated because every night you go to bed, you have reflux symptoms, you're burning those cells, and it can lead to cancer in some cases. You can get what's called Barrett's esophagus, and those are changes in the cells of your lower esophagus. So get it checked out.
Another thing that happens, someone will self-medicate with these over-the-counter proton pump inhibitors, and if you're on them, you know, they work great, but if you're on them for years at a time, that increases your chances of bone fractures. So there's side effects that if you're not working with your doctor, you're not going to know about that.
But I have the best cure for acid reflux. Can you guess what it is?
Sex.
Of course, that's
You
what
had
you
to
would
bring
say.
it up.
No, my favorite, and particularly my favorite at Halloween, but actually just any time, is candy. But a particular kind of candy. Did you guys know I was a candy connoisseur? I've tasted.
We're well aware of
You
that.
still are.
Yeah.
Once a connoisseur, always a
Well, I've
connoisseur.
tasted candies all over the world, and actually European candy, there's a European licorice, because licorice here in the U.S. doesn't actually contain licorice, or a special type of licorice, which is called DGL licorice. And that can actually help with acid reflux and other stomach irritations, but it is a supplement. So you have to be careful. You have to ask your doctor, because pregnant women shouldn't eat real licorice because it is associated with preterm labor. Also, licorice can be associated with high blood pressure, some cardiac disease. It can interfere with some medications. So be really, really careful when you get something that actually has real licorice in it.
Because real licorice is a root.
It's a root.
Licorice
And we
root.
have co-opted licorice in the U.S. and made it just pure
Something
sugar.
else.
Yeah.
I actually
This-
woke up this morning with a little heartburn, so this is great.
But it's not the real licorice that's one of my favorites. It's the fake one that we have.
Yeah, this real stuff's kind
think he likes
of
it.
nasty, man.
Yeah, the real
Why do
licorice is
people
harsh.
eat licorice?
Yeah. Why?
Oh, does
Because
anybody have any
they
tissue?
like the taste. It has sort of a bitter taste.
Oh man, that stuff.
It is. It
Well,
is.
you can-
Luckily, you
Do
can
you
take
need
it in a
this?
capsule.
If I give you any
Like
licorice,
that.
Travis?
trick or treating, you can have all of it. It's
You need this,
awful.
no?